People of St. Martin, I come to you today as Prime Minister and Chair of the EOC for today's update, April 2nd, 2020. In my last address on Tuesday, March 31st, I gave some updates where the details pertaining to the SMMC's capacity in dealing with confirmed and suspected COVID-19 patients were based on earlier discussions held over the weekend. I can hereby update you on the current capacity at SMMC. SMMC clarified in a communique of Wednesday, April 1st, and updated a few moments before getting into this press briefing that they currently have 15 beds available. 6 are for medium up to and including ICU care, and 9 are purely for medium care. These available beds have been made available for COVID-19 or suspected COVID-19 cases. SMMC has 3 regular ventilators and 1 mobile ventilator available for ICU patients. At the moment, there are 3 confirmed positive COVID-19 patients and 3 highly suspected cases in the care of the St. Martin Medical Center. Thus, from the beginning to now, 10 persons have been admitted to SMMC thus far. 3 have been discharged and 3 are critical, while 2 remain stable. Also, 1 highly suspected case, which was admitted last night, has reportedly passed away this afternoon. I hereby extend sincere condolences to the family and friends of the deceased and wish them all God's blessings as they deal with this very tough loss. This brings our total to 2, as the previously deceased person has been confirmed as a COVID case as well. Despite these rough couple of days, I do have some good news to report. As of yesterday, April 1st, 2020, I was informed that the local laboratories on the Dutch side of St. Martin, including HCLS in collaboration with our national lab SLS, is now cleared for testing for COVID-19 suspected patients locally. Results submitted before 3 p.m. will be made available the same day. As a result of the ability to test locally, we will be increasing our testing samples. Please take note that this will most likely result in an increased amount of confirmed cases. SMMC has also reported that the first COVID-19 related death never reported to SMMC for treatment prior to that day. Thus, the Prime Minister would like to remind all persons to reach out to CPS in the event that you are experiencing flu-like symptoms. Also, we remind you that 914 is an information line. It is not a hotline to get immediate service. If you are in dire conditions, you should call 911 or 912 in order to be able to get the response that you need. The St. Martin Medical Center continues to assist, and though their capacity may be small, they do have the capacity at this moment to be able to deal with all the confirmed cases that require treatment. In more positive news, during our ministerial consultations on health and COVID-19 challenges held this morning, April 2nd, between all 4 countries of the kingdom, including the BES Islands, it was concluded that out of the 42 intensive care beds which were promised by the Netherlands yesterday for the Dutch Caribbean countries and islands, though initially only 6 had been intended for St. Martin, now 12 beds will serve for not just St. Martin, but also included Saba and Statia, and wherever in the Dutch Caribbean they are necessary. The balance would be going to Curacao, and all of these beds would serve all of the islands in the Caribbean, the Dutch Caribbean. St. Martin is very much appreciative of the opportunity to receive this assistance, as we have been making repeated requests over the past month. After our pleas of yesterday, as well as the reports of the RIVM showing the high need for St. Martin, including pleas from our sister islands, St. Eustatius and Curacao, we have seen now that there is quite an interest to be able to serve the serious conditions and challenges we are facing here. We are continuously assessing new ways to source the capacities and resource what we locally, as such as we have been trying to partner with other stakeholders and businesses to see how we can identify other locations for quarantining where necessary isolation units can be placed. We were able to identify a location and have started the process necessary to certify the location for our quarantine and isolation needs. We expect that by tomorrow, this place will be ready to house some of our isolation and quarantine cases. We continue to partner with the community, and I would like to also at this moment thank all those who have reached out and provided donations to be able to meet some of our shortages in the community. I would like at this moment to update on our current COVID cases, as has been updated by CPS in the past few minutes. The self-quarantine numbers are now at 273. Self-isolation numbers are 123. The number of COVID patients tested or suspected patients tested are now 82. The number of that tested, 23 have been positive, 3 of which are still hospitalized. 18 males and 5 females. The negative number is 41, and we still have 18 pending. So that would probably mean that they have been tested during the course of today, as we have attempted to test much more of our isolated patients showing symptoms. 3 of these pending cases are also hospitalized. Deceased, we can now confirm, are 2 males and recovered 1 male. I would like to issue a warning on behalf of CPS. Persons exhibiting symptoms who have not yet registered at CPS 914 are encouraged to do so. This way we will have our true numbers and be able to follow up much quicker. We have been receiving offers of assistance for CPS, which we have gladly heeded, and I thank all those persons in advance as you continue to do great work. CPS also would like for the general public to remember to continue to practice social distancing now that we are under a larger quarantine where only the essential services are still open. You are encouraged, we are demanding that you stay at home. I've been getting reports from the police that though the traffic has decreased, persons are understanding the use of the forms, that even in the evenings and the daytime, many youngsters are gathering within the communities, within the districts where there's not a lot of traffic. You are not doing your community or you any good. Quarantining yourselves means staying in the house or around your own home. It does not mean going down the street to play with friends or gather on a corner and play dominoes or any other games that requires interaction. Again, stay at home. That's the best way for you to save yourself and your community. On the business closure sanctions, I would like to remind employers that fail to adhere to the mentioned closures that have been published today in connection with COVID-19, a fine can result in up to maximum 18,000 guilders in accordance with the list entitled Transaction List Related to COVID-19 Measures, as has been published by the Public Prosecutor's Office. Food suppliers that supply to supermarkets will continue to be able to supply, as well as bakeries. As mentioned before, only government construction and emergency services will be able to make use of construction, hardware stores, maintenance, and repair. And as of tomorrow evening or today, only restaurants will be available for those emergency services. Therefore, on Thursday, April 2nd, today was the first day in which the general public would not have been able to make use of restaurants. I encourage the people of St. Martin to continue to pay attention to the announcements being made via this government radio station, via government Facebook page and website, as well as through radio stations around St. Martin that continue to update you on a daily basis. As government of St. Martin, we would like to ensure that you and your family can be as safe as possible. Each and every one of you have a role to play in this. Ensure that you have activities within your home that will keep you busy, especially those students who are keeping up with their schoolwork. This is a great opportunity for parents and children to bond and show appreciation for the teachers who are going out of their way to continue to enforce learning at home. I would like to conclude with a simple message. We are a blessed nation. We trust and love God, and we should love each other. Yesterday, Minister Arian mentioned that he has not visited his mom in 3 weeks because he loves her. I would like us to think about protecting our loved ones by staying away. We can only stop the spread by keeping isolated or quarantined within our homes. Those of us that have to come out and work are a limited number, and this will also ease the burden on our police force as they will have to go the long haul, especially when we have to move to a total shutdown. Yes, this is still possible, so I implore you, follow the directions of the police. If you have no reason to be on the road, stay at home. Emergency services are included, such as food, pharmacies, going to the doctor. Otherwise, you have no reason to be on the streets. You do not need to be browsing in the supermarkets either. Get in, buy, get out. Follow our government radio station 107.9 for official information, as well as www.stmartingov.org/coronavirus and our Facebook page, Government of St. Martin. Be safe, St. Martin. God bless you. Until tomorrow.